The immune system protects the human body against disease by dispatching a bunch of immune cells whenever the body encounters foreign material or antigens. These immune cells elicit an inflammatory response in order to remove or eliminate the foreign antigen without causing much damage to the host. However, under certain conditions, the host may elicit an exaggerated or an inappropriate immune response to a foreign antigen, causing much damage to host tissues. Now, this exaggerated or inappropriate immune response is termed hypersensitivity. There are 4 types of hypersensitivity reactions, them being types 1, 2, 3 and 4. Now, type 4 hypersensitivity reaction is a T-cell mediated response, primarily caused by CD4 T cells, though these reactions can also be caused by CD8 T cells. Type 4 hypersensitivity is also called delayed type hypersensitivity due to its delayed onset of reaction. So type 4 hypersensitivity starts with the sensitization phase, where an individual is first sensitized to an external agent or antigen. During this phase, the exogenous antigen is picked up by an antigen-presenting cell, usually Langerhans cells, also called a dendritic cell. The Langerhans cell swims to a nearby lymph node and presents it to a CD4 T cell via the MHC2 molecule. On presentation of the antigen, the CD4 T cell recognizes the antigen through its T cell receptor and could differentiate into different T helper cell subtypes depending on certain cytokines present in the environment. Now, in the type 4 hypersensitivity reaction, the differentiation is usually skewed towards the Th1 subset of CD4 T cells. Langerhans cell produces cytokine interleukin 12, which helps this process. And sometimes the antigen-presenting cell could also produce cytokines like interleukin 1 and 6, which along with transforming growth factor beta causes the CD4 T cell to differentiate into the T helper cell 17 subset. Now, subsequent exposure to the antigen forms the effector phase of the reaction, and the manifestations usually peak at around 48 to 72 hours of the second exposure. The antigens are again picked up by the antigen-presenting cell, and this time presented to the Th1 cell, which kicks off a cascade of reactions. On recognition of the antigen, the Th1 cell produces cytokine interferon gamma. Now, interferon gamma activates macrophages, making them super active and alert. And these activated macrophages have better antigen-presenting abilities, increased MHC2 expressions, and improved phagocytosing capabilities. Activated macrophages produce pro-inflammatory cytokines like interleukin 1 and tumor necrosis factor alpha, which cause leukocytes to leak out of the nearby blood vessels. Leaking monocytes differentiate to macrophages, which are again activated by interferon gamma. Activated macrophages also produce interleukin 12, which could cause activation of more Th1 cells. And thus the accumulating macrophages in the site of infection release various lytic enzymes and free radicals to help remove the offending agent, in the process also causing a lot of tissue damage. However, there are occasions when the offending agent is not removed and persists despite the inflammation. This is usually the case with chronic granulomatous infections like tuberculosis, sarcoidosis, and some fungal infections. And in such cases, the persisting antigen causes a continuous loop of Th1 cells activating macrophages via interferon gamma, and the macrophages activating Th1 cells via interleukin 12. So the constant activation of macrophages by interferon gamma causes macrophages to transform into epithelioid cells that resemble epithelial cells, hence the name. It may also cause fusion of adjacent epithelioid cells to form multinuclear giant cells like Langerhans giant cells and foreign body giant cells. The epithelioid cells and the giant cells are surrounded by lymphocytes and fibrosis, and this mass is called a granuloma. Type 4 hypersensitivity reactions could also be mediated by CD8 T cells. Autoimmune diseases like type 1 diabetes and rheumatoid arthritis, graft rejections, and viral infections have CD8 T cell mediated tissue damage. Now, CD8 T cells damage cells expressing the offending agent and are hence called cytotoxic T cells. Now, it has to be remembered that all nucleated cells express MHC1 molecules. So for example, in a viral infection, the affected keratinocyte may express the viral antigen through its MHC1 molecule. And this antigen presented through MHC1 molecule is recognized by a cytotoxic T lymphocyte via its T cell receptor. On recognition, the cytotoxic T lymphocyte releases enzymes called perforins that create pores in the cell and then release granzymes into the infected cell, causing apoptosis.